everyone. Good evening to you. I'm Roxanne Vargas. Thank you so much for checking us out here on NBC 6 Voices with Jawan Strader, my friend Jawan Strader, my friend and yours. He is home resting tonight. I'm humbled and I'm looking forward to a really important conversation about our community and everything that we have been dealing with in reference to this global pandemic, which has hit so many around the world and certainly right here in the community. Especially now with the numbers that we had out from the Florida Department of Health today, we have surpassed 900,000 cases here of the coronavirus in the state. Together, Miami-Dade and Broward County hitting that 300,000 mark. It's all about numbers. And that's what we see, right? The statistics and the numbers on the screen, but it's about the lives and the solutions. How do we move forward here as a community? As all of you might have heard this week, there's been big news, hopeful news about a vaccine with Moderna and Pfizer, even some connections here to South Florida. So we're talking about it today. We're talking about it here on NBC 6 Voices, but specifically, why is there a hesitation and a rejection here? What are the issues that the Black community, that the community here at large has with going forward with not only the trials of the vaccines, but in getting a vaccination? We're going to talk about science. We're going to talk about facts and fiction here tonight on NBC 6 Voices. So thank you so much for joining us here on the NBC 6 Facebook page and on the NBC 6 YouTube channel. And again, keep your comments coming. That's what this is about, having an open, a real, honest, factual conversation. Excited to have it. And I'm certainly not having it by myself tonight. We have a very special guest joining us with lots of really incredible insight and expertise. I'd like to welcome this evening Dr. Cheryl Holder, the president of the Florida State Medical Association and professor at Florida International University Medical School. Doctor, thank you so much for your time tonight. I'd also like to welcome Dr. Rosemary Stiffen, an associate professor of chemistry and the chair of health and natural sciences at Florida Memorial University. Doctor, thank you so much to you for your time. And Dr. Freeman Rabowski, president of University of Maryland in Baltimore County, serving as a consultant to the National Science Foundation and the National Institutes of Health, among many others. Also volunteer for the Moderna COVID vaccine clinical trial. Dr. Rabowski, we're going to talk about that as well. So thank you so much to all of you for your time. I feel like I need to get something out of the way first. Obviously, we're having this conversation in a digital era. This is not my apartment. I do not have a fireplace here in South Florida. Okay, this is a virtual background, so I feel like I need to call that out. One moment there. What can I tell you? All right, let's jump right into it. Dr. Holder, I'm going to start with you. What are your thoughts on the two companies? Of course, Pfizer, which is talking about a 95% positivity rate, Moderna getting closer to that 95% approval rate, that FDA approval. What are your thoughts on this vaccine?
Well, what's really great is that the science has been proven. This has been under study for a while, the strategy in how this vaccine works, which is unique. So when we look at this vaccine, where it takes a part of the virus, the RNA, because it's a virus that's just RNA, they coat it in a product, a lipid, and then they insert it in the body, and your body makes antibodies to fight. So it harnesses the power of your body to be able to create the antibodies that will fight the virus if you are exposed to it. So the theory, the science, it all makes sense. It's really great proof of the way the project was designed. And so it's very good news in many, many ways.
Dr. Holder, I want to ask you a question, because I think we're all trying to wrap our heads around COVID-19. COVID-19, for such a long time, we have lived with and understood the flu. And medical experts such as yourselves joining us this evening have always said, get the flu vaccine. And we've also heard doctors talk about the flu vaccine being a moving target. Is that the same case for COVID-19?
It's too early to tell fully how long we'll be protected with this vaccine. Similar to the flu, yeah, we may not get immunity, the protection for a year. So it may be similar to the flu that every year we'll have to be immunized. So that does prove a challenge. We're hopeful that the vaccine will cover us as long as the flu vaccine, but none of these vaccines are perfect. So even the flu vaccine, on really good years, you may get 50% or so protection, that 50% of people will do pretty well. And our acceptance of the flu vaccine as a community, this is whether black, white, it's only about 40%. So we know there are challenges in getting adults to accept the vaccine that they'll probably have to take every year. So, but this infection is so much worse than the flu that it's such a killer that we are going to have to take a chance on it next time. Not sure which vaccine, but we're going to have to take a chance on the vaccine.
And that's the thing, there's so much that we're learning. It seems like all the information that we're getting out about this virus and about the vaccine and the ongoing trials, it's changing, right? We're constantly learning about it. And speaking of learning, Dr. Hrabowski, I'm going to go over to you. You have taken part and are taking part in the clinical trials for the Moderna vaccine. I should say you and your wife. So
yes.
To us tonight, why this was important for you.
I have the privilege of being at a university that's the #1 producer of Black scientists, people who get bachelor's and go, and this is at a predominantly white university. And one of those young people who went on to get a PhD is Dr. Kizzmekia Corbett, who is the lead NIH scientist in the development of the vaccine, works with Moderna and with Pfizer. And so I get to hear her talking about the issues. And one of the issues is that large numbers of people of color, African Americans and others, are very cautious about this. They're concerned. We hear all the time about the Tuskegee experiment and other ways in which medicine and science have taken advantage of people of color. And so the most important point to us was that those of us who are privileged and who appreciate the value of science need to step up, as we say, as my students say, to step up and show we believe in this process and that all people of all races need to take this vaccine. And so we are a part of a 2-year study. Just as Dr. Holder was saying, we are going to be looking to see how long a vaccine will last and how long you get the antibodies. And so it will be an evolving process, but we did it because of our belief in science, but also because I believe in my student, Dr. Kizzmekia Corbett. She's making history. It is the first time an African-American woman has been at the very top of that scientific chain. And it should give all of us goosebumps.
I have them right now, Doctor. Can you tell us her name one more time?
Dr. Kizzmekia, Kizzmekia. Her last name is Corbett, Corbett. She's the lead NIH scientist who developed the work that is a part of this vaccine. And it's a really big deal. And it's something for people of all races to be proud about, but it's also something that women should be very proud about because it can say to every little girl, you can help produce a vaccine that can save lives. Very significant. Very significant.
And the reason why I asked you to repeat her name, and I'm so glad that you said it and you spelled it, is so that we could all digest that information and set it. And we're gonna dive more into the history of vaccinations with Dr. Stiffen in just a bit. But Dr. Hrabowski, I want to ask you this because it's very rare that we actually get to have a one-on-one conversation with someone who is in the middle of a clinical trial, such as yourself and your wife, of course. What has it been like for you physically? Have you had any side effects? Have you become ill? Physically, how have you been dealing with it?
So understand that when you're in this trial, you have a 50-50 chance of getting the actual vaccine or the placebo. And this is the way they can determine the number of people who are getting the virus based on whether or not they've had the vaccine. Now, my wife and I are very hopeful that we've had the vaccine. And the reason is that in addition to a sore arm for a couple of days, we did feel unusually tired, fatigued for 2 days after taking the vaccine. And the word I've used with my students is loopy. You feel just kind of like you're in a daze or something. Something happened to my body. I know that. Now, let me not frighten people. It was not bad, but you felt a little differently for 2 days. And I would have, if it was just me, I would say maybe I'm being hopeful I got the vaccine. But Jackie felt the same thing, and 2 other friends who've done this felt the same thing. We actually did this work at the Center for Vaccine Development at the University of Maryland. And I should mention there are people there of all races. It's always good for people to see people like themselves in the process in helping with this. And we did see that. So that has been the experience. It was not bad at all. And we are very hopeful.
And I should mention that Jackie is your wife. I know you mentioned that, and I love that you said that. You know, we have all races and ethnicities here. That is the makeup of our country. So it's so important that you distinguish that. Dr. Stiffen, why often are people of color skeptical about vaccinations?
Well, actually, Dr. Hrabowski mentioned why there's a history that is somewhat of a negative reflection about how Blacks, minorities have been treated for certain diseases and vaccines. And I'm going to have to bring up the syphilis study that was done in Tuskegee. And that is still part of our history, it's still part of our mindset. So the reluctance is more about, it's a combination. It could be the healthcare disparity that is in our country, along with just a distrust of the medical field based on what has happened in the past, and not just Tuskegee.
And it's not just Tuskegee, but you think about that specifically the Tuskegee experiment. It started about 90 years ago, and the life expectancy of so many reaches that. So it's still, 90 sounds like a big number, Dr. Stiffen, but it's still very raw and very real right now.
Well, I think it's raw and real because it's not in the antiquity of our history. It's less than 100 years ago. But after that, after the Tuskegee experiment, after they allowed these men to die of syphilis with a cure using penicillin, after that, we had the HeLa cells. How did these cells come about? They took the cells from a patient and did not give her any compensation. She died anyway, but her family got nothing, and they didn't know about it for years. After that, young women being sterilized without their knowledge. Unfortunately, that just leaves a negative, a bitter taste in a lot of people's mouths. And then to have the vaccine come out relatively so quickly, and people still aren't learning all there is to know about this virus, I can understand the hesitation and the reluctance. And I applaud Dr. Habowski for in Maryland. I think that's great.
But I want to add to what she said. As an Alabamian growing up in Birmingham, all of my life I heard about that Tuskegee experiment. My mother's a graduate of Tuskegee, and it's that history, but it's also the present situation, because we have too few people of color, Blacks, Latinx, who are in the medical profession, in the scientific community. Those who are there are wonderful and valuable, but we need so many more. People need to see people like themselves who are practicing medicine, who are scientists. When you look at the national agencies, and I'm a mathematician actually, but when you look at the national agencies throughout this country, fewer than 2% of those scientists are Black. So we know we have a challenge to have more people represented in these professions if we want people to trust science and evidence.
Yeah, I have to follow up with Dade County in Broward. We're a little different. So the Tuskegee history isn't as well known to many of the immigrant Blacks. But what is well known to the immigrant Black is the lack of access to health care, is when you do access health care, you sometimes aren't treated as well as you would expect. So there will always be some mistrust. And then when you, overall, the basic structural issues that we see that discriminates against many Blacks leaves the entire community being very concerned. And when you see the death rate that happened with coronavirus, and we understand the disparities, yet much of the response has still not been clear and consistent, and in a way that offers any empathy or compassion for what many of the groups that are front line have experienced, it's hard to then say, oh, I'm going to embrace what this group is going to offer me. So I understand why communities will be very concerned about jumping on the newest vaccine that hasn't been fully tested for a disease that we don't know enough about, and from a group of folks and a system that hasn't treated us so well.
Dr. Holder used the word empathy, and I think that's a word that we should all continue to circle back to, because there's a very real racial disparity in our community and across the country. We've been talking about it, especially now more than ever. The fact of the matter is, here in the state, as of today, according to the Florida Department of Health, we've hit 18,000 deaths. Those are more than 18,000 deaths from this virus. And there is some hope that this vaccine, once it is approved, Then there's the task of, you know, how will it be distributed and to whom and how? There's a little bit of hope there. Dr. Stiffen, I want to go back to you. What is your take on this vaccine?
Well, as Dr. Holder said, they use mRNA, and the virus itself is an RNA virus, a positive RNA virus. And so one of the key proteins that's involved in the infection is called the spike or S protein. And this spike or S protein is very antigenic to the body. So what Pfizer and Moderna have done is that they have created the mRNA that's going to code for the spike protein, encapsulated, that is, surrounded that mRNA with a lipid coat and injected it into the volunteers. And this virus, this mRNA is going to code for the spike protein. Now that means that there will be antibodies created against this non-self protein, and that is going to be your immunity. You're not infected with the virus at all. It's not attenuated. It's not heat inactivated. You're simply being injected with mRNA. And this mRNA is only the genetic part of the virus, not the protein. And so I think, Dr. Hrabowski, that's why you might have felt a little bit loopy, but because you weren't injected with the virus itself, whether it was attenuated or heat inactivated. And so one of the concerns that I have for the mRNA is that this virus will mutate, as all viruses do. And one of the mutated strains is in the S protein. Well, that's the vaccine we're given, is for the S protein. And if we go into the general population with the vaccine, will we have the right antibody for every spike protein? Because the virus can and will mutate. One of the mutations is called D614G, and that one is a little bit more virulent, a little bit more transmissible, and even possibly a little bit more dangerous. So we want to make sure that this vaccine is going to be against that spike protein and not another one.
So just a comment. First of all, it's great for the public to see a scientist and a physician, African-American women, talking with such authority about the scientific issues. I think one of our challenges is to work with our scientific community within people of color to give them more information, to have opportunities for them to raise different questions so that they can have confidence in the vaccine. If we're going to get a message out to people that this is the best we have, because everything I'm hearing is very encouraging. I think it's very important to have all the questions raised as Dr. Stiffen is raising, but I do think a part of our process must involve including the African-American, Hispanic, or Latinx populations of scientists and doctors to get a chance to ask questions so that when the communication goes out to the general public, since most people don't know science, that they can have confidence in those people. It will be important. For example, the 4 presidents of the 4 Black medical schools wrote an article talking about the importance of this vaccine just recently in the New York Times. If you look at CNN, you can see Dr. Corbett as an African-American woman talking about the science and where we are right now. We need many more conversations like these in order to allay any concerns that Black scientists have, in order for them to be able to say, yes, it's that time to do it. Just as Kamala Harris said when they asked her if she was going to take the vaccine, she said, when Dr. Fauci takes it, I'll take it. And I know he's going to take it. And a lot of people believe in Dr. Fauci. That will help a great deal also.
And pose this very same question as you just said. I'm not sure if my audio came out. I'm going to go ahead and pose, Dr. Hrabowski, that very same question that you just mentioned and that lots of families here in our community will probably have among each other. Will you take that vaccine once it's out? Dr. Holder, your answer.
Well, when I get the data, and just like Dr. Hrabowski said, and Stiffen, we need to hear and learn more about it. But before we can say yes or no fully, I am going to take a vaccine. Now, I am not sure yet, and I can't absolutely say because the data is just preliminary, which one it's going to be. But our only answer to this viral infection is a vaccine, and especially one that uses your immune system to fight it. So definitely I'm taking a vaccine. Can I absolutely say this one? I need the data. I need more information.
And you should keep in mind, it's only been a few days that we've been beginning to hear the data. And so it will be very important that our chemistry professors, our heads of medical associations and others get a chance to review this. I know that FDA is looking at it also with NIH. And then we need a major effort on the part of the experts and others who've gotten the data and see it to say exactly what Dr. Holt just said. We reviewed it now and we're ready to do it. Because it's going to take time for people to have the trust in the evidence and to get over all the history of challenges people of color have faced. I can tell you from being with my graduate and listening to her a lot, we're very proud, and I'm encouraging people to do it. But I do think getting the data so that the experts can say it, very important.
Dr. Stiffen, I'll ask you now, will you take the vaccine once it's available?
Let me speak a little bit about the vaccine itself before I answer that question. This is an mRNA virus, and as Dr. Holder might know, Dr. Hrabowski probably doesn't know, but his student, Dr. Corbett, should know. Messenger RNA is very fragile, and even though it is encapsulated, it is stored by Pfizer and by BioNTech and by Moderna at a very low temperature to keep it stable. Well, our body temperature is 98.6 degrees Fahrenheit, roughly 37 degrees Celsius. And God forbid if this mRNA somehow stays out before it gets into the human body at a temperature that's above the storage temperature. That could lead to degradation of the vaccine, and you're injected with something that might be ineffective. So saying that, I will take my chances and not take the vaccine as of today.
So
I'm
going to get Dr. Corbett to you, Dr. Stiffen, so you can have more confidence in this. I
do know that RNA is very fragile.
Sure.
They're not using DNA, they're using RNA. And so even though you're going to make the protein, and even though you have the mRNA in the correct sequence, it is a fragile molecule.
Haven't they said that they have to follow very carefully the guidelines? As I understand it, the Moderna temperature can be higher than the one from Pfizer.
Yes.
So that helps. It does, right? And they're going to have to be very important. They're going to have to be very careful about following those guidelines, is what you're saying.
It helps with storage.
Yes.
But, I mean, you may be waiting in the office for 25 minutes to be shot. And students who have worked on mRNA know that it can degrade. It can degrade.
Yeah, there's some concerns. I mean, we know also that the vaccine may give you sufficient antibody response that you could still have a low-grade infection in the nose that could still be asymptomatic carrier. So then will you always have to wear a mask even though you are going to fight the infection? Mm-hmm. So I don't know. This is where the data is necessary to see after you get this vaccine, what happens if they check the nostril, see, are you also getting another infection? So there's so much more data to come. And I think we'll get that answer soon. And then we'll be much more comfortable saying yes or no. And since we know we got to save some lives, especially folks who are elderly, if you look at Dade County statistics and Broward County statistics, the people who are dying are elderly. And so we need to get enough people who are the spreaders protected from infecting the elderly. So we have to do something or else we have unnecessary deaths.
Right. So the question becomes, what choice do we have? I think you're right. What I'm hearing is that they're getting more data every day. It is very interesting that the regular flu vaccines that many of us take are only 50% or so effective. That so far, the data that they have from both places would suggest that it's been about 90-some% effective right now, but they're getting more data every day. And I would say it's going to be an evolving process. We'll see people taking it. We'll see how it goes over this next few months.
Process, and as that data comes down, we are so grateful to experts such as yourselves who are taking that data, digesting that data, and then breaking it down for all of us to understand. We are so grateful for everything that you do and for spending time with us tonight here on NBC 6 Voices, especially as we head into the holidays. Thanksgiving is a week away from tomorrow. People will be gathering with friends and family, hopefully with their quarantine circles, because we really, Dr. Holder, as you said, we got to get this thing under control. So with that said, I thank you all greatly for your service to this community as scientists, as healthcare workers, and as experts, and really as members of this country and this community. Dr. Holder, Dr. Hrabowski, Dr. Stiffen, thank you so much for your time and for everything you continue to do. We appreciate you.
May I say something? May I say something?
Real quickly, Dr.
Is it possible that I can say something? Dr. Hrabowski, I'm going to have to jump on your bandwagon. I mean, you're talking about how many students have you generated in the health field. We've done the same thing. I'm very proud of the graduates we have. We have students who are graduated and they're working right in the front line with the virus. They're medical doctors, they're pharmacists, they're pharmaceutical scientists. So we want this transparency. We want this role model, but we still have to go back to the fact that there is an historical bent to this. But we have also done very similar to what you've done at a much smaller scale, but continuous. And so we do want to diversify the medical field by producing more Black scientists, and that is my job as a chemist. That's my job as a Black person.
Thank you, both of you, because as a doctor, we need more. So I look forward to the students you prepare for us.
Great.
Well, Dijon says hello.
That I am not a doctor nor a scientist. I have the utmost respect for all of you and your beautiful brains, but I will say, as a young girl waking up every single morning, my kitchen table, I woke up watching the news every single day. When I saw the first Latina on television, I said, she looks like me. I can do it. So I understand what that's like to look into the field where you hope and you dream. And when you see somebody that looks like you say, I can do this. And that is the most ultimate power. And that's what we're doing here tonight. So again, we thank you so much. We're going to continue the conversation with more community partners. Again, Dr. Holder, Dr. Stiffen, and Dr. Hrabowski, thanks to you. And we appreciate you. Thank you again.
Thank you.
Thank you.
Bye-bye.
All right, folks, we again appreciate you for joining us here on the NBC 6 Facebook and YouTube pages for NBC 6 Voices with Jawan Strader, who is off tonight, but I'm Roxanne Vargas. Call me Roxy. I'm so happy to be here with all of you tonight. We were just having a really important and tough conversation about vaccinations as far as trying to control this pandemic, right? COVID-19 and what it's done. One of the things that this pandemic has done is it's created job loss and food insecurity across the country, and certainly right here in the community. I got to tell you, I've never been more proud to be a local from this community and certainly be a sports fan when I see my team step up and make a difference, and how that action really makes a difference and impacts the rest and the arteries of the community. I am talking about the Miami Dolphins, who have served this community, making sure that nobody goes hungry. The Miami Dolphins Foundation Food Relief Program stepped up from day one and said, there's a problem in this community. We're gonna get on the field and then get off the field to fix it. So I'm excited to have this conversation tonight with more of our community partners. So let's go ahead and bring in Jason Jenkins, the Miami Dolphins Senior Vice President of Communications and Community Affairs. Jason, you there? I see you loaded. What's up, my friend? How you doing? Appreciate you being with us tonight. Also joining us this evening, Pastor Arthur Jackson of the Antioch Missionary Baptist Church. Pastor Jackson, you'll be joining us now. Thank you.
Hey, Jason.
Thank you so much for being with us. We're also going to welcome Mr. Bodie of Lorna's Caribbean Grill in Miami Gardens. Mr. Bodie, you'll be joining us. Thank you so much for your time. Jason, I know you're on mute, so we're going to make sure that you're going to mute yourself in just a bit, because I do want to start with you. I wasn't surprised at all. Oh, Mr. Bodie's getting on. Hi, Mr. Bodie. How are you?
How you doing?
Doing all right. Thank you so much. I hope you and yours are all well in this crazy time. Jason, I wasn't surprised when the Miami Dolphins stepped up. It's what you guys do. This is your community. You love it. And literally feeding the need, quite literally from day one, not only feeding the community, but it also gets people to work. So tell me more about this call to action from the Miami Dolphins Foundation.
Now, what you outlined in that amazing first segment, you talked about COVID-19, talks about the job loss, talk about the long-term issues that we're dealing with. So at the Miami Dolphins, we definitely wanted to step up and do our part to combat food insecurity, but also go a step further and talking about employing our community and also providing economic resources for our businesses, especially those that got hit by the pandemic. So our owner, Stephen Ross, our vice chairman, Tom Garfinkel, came up with the idea for the food relief program. And it started on June 1st, and we're going to do it at least for a year, where we're giving 1,000 meals each day out of Miami Gardens Hard Rock Stadium for Center Plate, but also working with the community to help minority-owned businesses as well. And started with Pastor Jackson. He was a proponent of it from the beginning. We sat down and talked with him. We started with the church and started with the schools, but then also he gave us recommendations and also other pastors as well about restaurants that were hit as well too. So the great thing for us is not only have these meals and generate activity at Hard Rock Stadium from people that lost jobs due to the pandemic, but also enrich our local community, especially in Miami Gardens, the Liberty City area, Opelika, et cetera, those that were hit hard by that, and really do it for a long-term basis.
Pastor Jackson, you heard Jason there mention the work community multiple times and how you were one of the first people the Dolphins tapped. Really getting in there. What's the pulse of the community? What's been the response?
The post. First of all, thank you. The pulse of the community is incredibly grateful. Jason reached out to us, and we were more than delighted to partner with the stadium. When he first reached out, I considered it to really be a godsend. We were looking to have a partner with us to help facilitate the need in our community, which is so great. Of course, everybody is hurting. Everyone is struggling. COVID is not just affecting African American communities. It literally is affecting the world. And so we needed a strong advocate and a strong partner to step in. And I'm so incredibly grateful to the Dolphins organization for coming to lend their support, a long-term commitment. And I can't think of any other company that would have stepped up to do what they did. No one made them. It's just out of the kindness of their heart to want to do this to help our community. And I'm eternally grateful for it. And in turn, it allowed us to reach out to other businesses in the community, like Lorna's Caribbean Grill, and other restaurants in the community, primarily African American owned restaurants. And so it's been a trickle down effect, and it's just been a tremendous gift, tremendous blessing.
Pastor Jackson, you said one thing I was going to tap here, long-term commitment, because anybody who thinks that this is going to go away at the strike of midnight, January 1st, 2021, that we already know that is not the case. There is a need here, and it is a long-term need for those who are still facing food insecurity. And so many businesses, minority-owned businesses here in our community, they're trying to figure out like what's next. You're trying to look for that light at the end of the tunnel, and it's dim for a lot of people. Mr. Bodie, I want to turn to you. Tell me about the impact that the food relief program and working with the community has had for you with Lorna's.
It's been amazing. We thank God every day for the Dolphin meal. They do an amazing job, especially Pastor Jackson, all the Dolphin family. It helped us a lot because with this COVID stuff going on, it's crazy. But by them helping us every day, every week, it helped our business a lot. And I thank them so much.
Mr. Bodie, it's not just paint a picture here to everybody watching, because it's not just you and your restaurant. We as minority business owners, we employ our families and our friends. So sometimes when one restaurant takes a hit, it affects the entire family.
It does. But go ahead. You gonna say something? Yes, it affects a lot of people, man. But with Pat Jackson and all the Dolphin family, we just thank them, like I say, so much because it was hard for Lawrence Restaurant, but they helped us a lot. It really did.
Jason, I want to go back to you. We're talking about a potential impact here from the Miami Dolphins with this food relief program of about $5 million. Quite an undertaking as well. Can you speak again to why this was an important move for the Miami Dolphins Foundation?
Yeah, it was a multi-million-dollar commitment, from our owner Stephen Ross, the vice chairman Tom Garfinkel. But the whole idea is that we feel we're stewards of the community, and this community has meant so much to us. And it was our role and responsibility and accountability to give back and really do it in a way that was significant. Like everyone has said, this pandemic is not going to end on January 1st, February 1st, March. That's why we want to make this long-term, year-long commitment. And what we've seen, and we hope this awareness and hope these stories can help people support these businesses. And you talk about the family unit that's been impacted for it. This struggle is going to be long, the struggle is going to be deep, and it's going to touch a lot of people. So as many organizations, as many restaurants, as many people that have, and just seeing the photos, the videos, the pictures, and when people get these meals, it's impacting them, but also in terms of service to the community to be able to do that. And these restaurants, what we found out, they all want to be able to do these things and help people, but that's at a cost. And so we weren't going to let these restaurants, these businesses go under by their service. We wanted to make sure we use our resources, our platform. You see, we have a food relief partner each week at the Dolphins game that we highlight. And we hope that our efforts can not only help marketing, help advertising, help make sure these businesses are top of mind for everyone as they go through this pandemic, because everyone needs help. And we want to make sure the Dolphins were in our community 365 days a year, doing good work, not for publicity, not for the pat on the back, but also to make sure that we're keeping this economy going, especially in these areas that are so close to our home.
On that same note, Roxanne, if I may chime in, the Dolphins organization do so much for the community. When I met with Jason, I was actually surprised at how much charitable funds are given, how much work is done, how many non-for-profit organizations they support. And I was one of those who was encouraging them to kind of like put it out there, because so many times persons in our community will look back and they see this massive organization and they think it's just about football, it's just about revenue, just about selling tickets and events. But I'm telling you, Mr. Ross, Mr. Garfinkel, and the entire organization have really put their money where their mouth is. And even though we're highlighting the food program, this is just one of a plethora of charitable things the organization do on an ongoing basis. They're just not in our community, but they are literally partnering with the community. So when you talk about community partners, I know that myself and Mr. Bodie, we're on, but really the organization, they are true partners in our community. And I just can't, as Bodie said, can't thank them enough.
Yeah, I'll agree with that. I'm a testament to that. I've seen it with my own eyes, involved as well with minority-owned businesses, Hispanics, and the LGBTQ plus community as well. The Miami Dolphins has been very loud and outspoken with that. I'm going to ask this question to Jason, to Pastor as well, and to Mr. Bodie. You've been out there, right? You've seen the lines, you've seen the people. Have we seen a decrease of the need? Have we seen the line shorten a little bit, or is the need just as great for these meals, or have you seen the lines get even longer?
No, I mean, we've actually seen the lines, especially during this time. October was our biggest month, in terms of that. At the end of November, we're going to hit over 260,000 meals distributed, and especially with Thanksgiving and the holidays coming up. People are going to continue to need that support. So we have a lot of great Thanksgiving activities, set up. We expect December to be heavy, and like kind of what was said in the first segment, is this is going to be long, and this is going to be, a serious situation with or without the vaccine. Well, people will still need the help. So we've seen the uptick over the last couple of months. We expect it to be more in November, December, and then we'll see what January and on, takes us. But we're here each and every day to do our part.
So you're talking about the need going up. We saw in those images, there's lots of lifting, there's lots of love, there's a lot of involvement. How can we get involved? For anybody watching tonight or seeing this in the future, how can we help make a difference?
Well, if you could go to dolphins.com/meals, it talks about the program. It talks about the support. We have information about the businesses that we're, working with as another way, to market them as well. But we have a match program. We're going to match up to even $1 million more for the community. And we've got a lot of great support. Lennar Foundation provided $1 million a gift as well. And a lot of people are coming in and, seeing the results of what we're doing. So dolphins.com/meals is a great place to go. But again, our website is full of information, and our social media as well.
Speaking of meals, it's about 8:20. Mr. Gordon, what is the must order on the menu, sir? Just saying.
Yes, rice and peas, macaroni and cheese, ground stew fish, stew cum, fry cum, cum soup. So that's one of our top dishes. Our grilled salmon, blackened salmon. You have to come try it one day.
I can vouch for it. I definitely can vouch for them. It's one of my go-to places, Roxanne. I highly recommend you come to the gardens and stop by Lorna's. It's amazing food.
Amazing indeed. Jason, can't let you go without just proving to you that I could say Tua Tagovailoa's name.
We appreciate it. We've been on a big streak, and then you talk about our head coach Brian Flores, our general manager Chris Greer, great representatives for the community, the only African American and Honduran duo in the league. So we're proud of that. We're proud about the diversity in our organization from our senior leadership team, but also we're excited to be great people on the field. But now Pastor Jackson said, be great stewards off the field as well.
But when you do good things come back in return. One of our favorite phrases at the church is that favor follows faithfulness. That when you're faithful, great things, favor comes. And so, hey, I'm not surprised. You guys are just killing it right now. Congrats.
Thank you.
So we leave you with hopeful words of prayer with Pastor Jackson. We leave you with a belly longing for that Kong soup with Mr. Bodie. We leave you with a hopeful season that Tua and the rest of the team and our Miami Dolphins will keep making a difference, not just on the field, but off the field as well. They will continue to do that. Gentlemen, we thank you for everything you continue to do in our community, and certainly for your time here tonight on NBC 6 Voices. Thanks so much for everything you keep doing, and we wish you a peaceful holiday.
Thank you.
Thank you so much.
Thank you. All right, folks, that does it for this edition of NBC 6 Voices with Jawan Strader. Again, I'm Roxanne Vargas, filling in for Jawan tonight. It's been a privilege to moderate this important conversation, one of many conversations that we will continue to have here online and certainly on air on NBC 6. In the meantime, I'm going to get home to my kiddos, and I will see you tomorrow on the NBC 6 News with my co-anchor, Shelly Moniz, at 12 o'clock and again at 4 p.m. Stay safe, cover up, and we'll see you tomorrow. Good night.